It just depends on what your particular needs are as to where we're going to fit in here. The difference between these two is that this you're paying in advance. It's predictable. We budget. My wife is going to budget X number of dollars per month for our medical expenses, and that's predictable. We're not going to have any runaway medical bills. Over here, it's less predictable because every time that we use it, we're having to pay. And believe me, these out-of-pocket costs really add up. Deductibles, copays, and coinsurance. Really, really quick illustration of that. Let's say I've got an earache. My wife says, you need to go to the doctor. And, okay, go to my doctor. It costs me $20 to go to see the primary care physician. I go to the doctor. The doctor says, I don't see anything. I think I need to send you to the specialist over here. And I'm going to send you to the specialist also. Well, the specialist, I pay a copay there too. And it's a little bit higher. It's maybe $30, $35. So now I paid my primary care physician. I paid 2 specialists a higher copay. This specialist over here says, I don't see anything, but an earache could be a sign of a tumor. So I'd like to get some imaging. And this doctor over here says, I don't see anything, but viral infections are harder to detect than bacterial infections. I'd like to order a blood lab. So now I've got a couple of procedures going on. Guess what? Those have copays too. Every time the carousel goes around, they're collecting more copays from me. My little earache is now getting to be an expensive earache because nothing is that simple when it comes to medical stuff. It's just not that neat. It's always more involved than what we expect. I have this saying my kids will probably write on my gravestone someday. Everything is twice as hard, takes 3 times as long, and costs 4 times as much as you think it ought to.